So our fourth panel for the day is going to be entitled The Power of TV and Film in Advancing Ideas to Improve Health and Alter the Factors that Shape It. So our moderator for this panel will be Dana March. I'll be back for an encore here. She is the editor-in-chief, as you remember, of the 2x2 project at Columbia University School of Public Health. Dana, you'll have to tell us where the 2x2, how you got that name sometime. Kate Fulp, Director, Hollywood Health and Society, USC Annenberg School for Communication and Journalism. And Rachel Poulin, Associate Producer from California Newsreel. So we are delighted to have this wonderful panel with us to talk about the power of TV and film in advancing ideas to improve health. So please. Yeah. Say. Yes, I'll bring it to you.
Well, good afternoon, everyone. So we had the pleasure of delaying your lunch earlier with our social media panel, and I have the distinct pleasure of moderating a wonderful panel after lunch. And so I hope you're all still with us now. But I wanted to just make a few remarks, and I thought we would try to be done by 4. Rochelle Poulin, one of our panel members, has to leave to go back to Oakland by 4. So I thought we would, since we're missing one of our panelists, unfortunately this afternoon, that we could take the opportunity to stop by that time. Just a few remarks on television and film. I think that we've heard a lot today about various types of media, whether it's print media or digital media, social media, in advancing ideas to improve population health and alter the factors that shape it. But we have an obvious absence in our coverage of media so far today, which is television and film. They're incredibly powerful media for disseminating health information, promoting health, and constructing powerful narratives around health. And I think we often think about TV and film as constructing individual narratives around health, but I think that it's sort of one of the principles that drives the health communications work that I do is that there are obvious ways in which television and media can cover health issues, overt health issues, population health issues, and also uncover some of the more subtle ways in which population health can be featured in narratives and stories. And I think that television and film has had a very particular role in shaping how we think about health, whether that's individual medicine or even population health, and our understanding about health and disease. So we could go all the way back to 1941 and Betty Davis and Herbert Marshall film called The Little Foxes, which I don't know if you've ever seen, but it is the granddaddy of all heart attack films. Well worth seeing. It strikes absolute terror into you. It's a very powerful black and white film. To films like And the Band Played On, which covered a very critical moment in the AIDS epidemic and the search for the virus or the cause of AIDS, and all of the myriad people who were involved in that effort and how powerfully shaped by culture and fear and stigma that effort actually was, shows like St. Elsewhere or ER, or even one of my favorites growing up, Quincy, and how we think about health and disease from an individual to a population level. But I think the take-home message is really that the moving picture is incredibly powerful, whether it's in TV and film or in documentaries that expressly cover health issues, whether that's, again, individual medicine or population health, is an extraordinary tool to be able to leverage. And I'm very honored to be able to moderate this panel on harnessing the power of TV and film to shape our understanding of population health and the factors that affect it. We have two distinguished speakers today. Kate Fulb, who is the Director of Hollywood Health and Society at USC's Annenberg School of Communication and Journalism. Rochelle Poulin, who is an associate producer for California Newsreel and was one of the associate producers for Unnatural Causes, which was featured on a slide earlier, which I think you're all well familiar of and really captures the issues around the social determinants of health, which has become sort of the buzzword and problematic term of this particular conference. Unfortunately, Neil Baer could not join us today. He has fallen ill, and unfortunately, we won't have the pleasure of hearing from him today. But I think that some of the issues that Neil was going to cover, probably between Kate and Rochelle, we can tackle those issues. So what I would like for us to do today is explore both the obvious and subtle ways in which population health and in fact, individual medicine is featured in TV and film, and the ways in which these issues winnow their way into TV and film. So we'll start off with Kate, and then we'll move on to Rochelle, and followed by a discussion and a summary of what we've talked about.